So I trained in pediatric emergency medicine at Boston Children's, and when I was there, my focus was on febrile children. And in particular, I was interested in creating decision algorithms to help clinicians distinguish which children with fevers have bacterial illnesses from those with viral illnesses, because the clinical implications are obvious. That is, those with bacterial infections need antibiotics and they sometimes need to be admitted, and those with viral infections typically can come home. So we created some important algorithms, and then when I moved to UC Davis, there weren't that many children with fevers. What there was a lot of pediatric trauma patients. And the trauma patients at UC Davis back then, they were all getting CAT scans. And CAT scans is a great technology for identifying injuries, but it poses risk to children with the amount of radiation, and so you don't want to do it unnecessarily. So I knew something needed to be done to make sure that we're irradiating the appropriate children. That is, we're getting the CAT scans on children, only those who needed it. So I applied the principles that I learned as a fellow at Boston Children's and the School of Public Health there to the pediatric trauma patients here at UC Davis, and started creating decision algorithms on which children with injuries needed to have CAT scans. And this really was the inspiration for me to create the PECARN head injury rules and work with Jim Holmes to create the PECARN abdominal injury rules to decide which children really needed CAT scans and which did not.